Good morning. Busy day, a lot to do, so let's get at it. From my left, Robert Mejica, Director of the Budget. To my immediate left, Melissa DeRosa, Secretary of the Governor. To my right, Commissioner Howard Zucker, Dr. Zucker. To his right, Mr. Gareth Rhodes. To his right, Mr. Shatad Floyd, who is in charge of legislative affairs and policy and has been handling our special outreach efforts. We're going to talk about COVID for a change, not really for a change. It has been the ever-present topic. COVID has done tremendous damage in the state of New York and the nation. It's continuing to do damage, continuing to lose lives every day. But it's also been a moment of reflection, a time we should reflect, a time we should take stock. COVID taught us many lessons. COVID exposed injustices, fundamental injustices that existed all across the country. They're not new. They were there. It's what we call, it created low tide in America. Low tide in America. The tide, when the tide is high, the tide covers all sorts of problems that lurk underneath. When the tide goes out at low tide, then you see issues that were always there, but which were not apparent. COVID created low tide. It exposed fundamental issues that were lurking beneath the surface, ugliness that was beneath the surface. It exposed the failures in a public health system, that we were just not prepared for COVID, despite SARS, despite MERS, despite Ebola. We were just not ready for it. It exposed incompetence in government because government had to actually perform. And you saw that when the federal government, for example, fails to perform, people literally die. It showed failed leadership in government. And it showed structural racism and discrimination that existed in America, but was not readily apparent unless you wanted to see it. And there are many who did see it. And we talked about two Americas and talked about the structural injustice and structural racism in our society. But at low tide, there was no denying the existence of it. COVID killed black people at twice the rate of white people. That is a fact. It is a fact that should make us uncomfortable. It is painful to say. COVID killed Hispanic people at 1.5 times the rate of white people. COVID infection was 3 times higher in the Black and Hispanic communities. Despite that, nationwide, Black, Hispanic, and poor communities had less access to testing for the virus, even though they had a higher infection rate. Majority black zip codes, 67% more likely to face a shortage of primary care doctors. That's why there were underlying health conditions at a higher percentage in Black, Hispanic, and poor communities. So any American rescue plan must rescue all Americans and must start with an awareness of the low tide reality and must correct the structural racism and discrimination that we have all now seen. There's 2 obstacles. One is what we call here vaccine acceptance. Some people call it vaccine hesitancy, but actually it's worse than that. And we believe you'll never solve a problem you're unwilling to admit. And the language we use is important. It's more than acceptance. It's more than hesitancy. It is a lack of trust of the system. And I understand it, and we should all understand it. It is a lack of trust of the system and of the government. Well, the federal government approved the vaccine to be safe. Yeah, the federal government also conducted the Tuskegee experiment. So it is real, and it's deeply rooted with valid cause. And the second obstacle is the access to the vaccine. Now, we've talked about access and fairness in the vaccine from day one. And we were very outspoken in New York in saying that if you use the traditional health system to distribute the vaccine, you will recreate the same problem that we've seen for the past year and decades before that. If you just go to the existing public health system, it doesn't exist in healthcare deserts. That's why they're healthcare deserts. If you go to the traditional doctor network, you won't reach these communities. That's why they had already underlying conditions at a higher percentage. So any distribution of the vaccine has to take that into consideration at inception. Now, we were also fortunate to have great voices and great leaders step up and lead the way with us. Reverend Al Sharpton, the National Election Network, Mayor Mark Morial, once a mayor, always a mayor. It was my good fortune to work with the mayor when he was mayor of New Orleans, now as the president and CEO of the National Urban League, and Mr. Derrick Johnson, president and CEO of the NAACP. We pointed out this issue early on, and we said that it had to be addressed, and we're going to continue to say it, and that this nation has to learn the deeper lesson of the structural healthcare disparities that were revealed at low tide. Today we're announcing a federal-state partnership to open mass vaccination sites where they are most needed, what's called socially vulnerable communities. We're pleased and happy to announce 2 mass vaccination sites in socially vulnerable communities, one in Queens and one in Brooklyn. We're working on several sites in upstate New York. In Queens, it's going to be in Jamaica, Queens, my old stomping grounds. This is a Queens accent, by the way, not just a New York accent. Mass vaccination site that will do approximately 3,000 vaccinations per day. That will be the largest vaccination site that the state has opened to date, the largest mass vaccination site in existence in the state of New York. Second one will be in Brooklyn. Again, 3,000 vaccinations per day at Medgar Evers College. And again, at 3,000 vaccinations, it's the largest in the state of New York. They'll open the week of February 24th. We're going to do additional sites in upstate New York and socially vulnerable communities in partnership with the federal government. And these sites are different than anything we've done before. The federal government is going to provide a special dosage allocation for these sites, and they will be staffed jointly by the federal government, federal Army personnel, among others, and state personnel, National Guard, among others. So these are going to be very large sites. They're complicated operations, but they're going to address a dramatic need in bringing the vaccine to the people who need the vaccine most. It's the first step, but only the first step. We need more to do. New York, we pride ourselves on being the progressive capital of the nation, not just in talking the talk, but in walking the walk, not just in rhetoric, but in reality. We're not a government that just postures and pontificates. Get it done. Get it done. It's about results. It's about making a difference in people's lives. That's how you judge a government. That's how you judge an individual at the end of the day. I want to thank Reverend Sharpton, who has been a great advocate on this issue, bringing attention to it early on. Same with Mark Morial and Mr. Derrick Johnson. Thank you for making the case and making it over and over and over again and bringing this nation's attention to this issue. And we're pleased and proud to do it with you in partnership in New York State. And I think the combination of talents and the approach has worked before. We've made great progress that no other state has made in many social equity issues, and we're going to do the same thing here. I want to thank President Biden, who understands this issue and has addressed it. Jeff Zients, who is the coordinator of the administration's COVID effort. I've been working with him very closely, and he's been working with the governors very closely. I want to thank him and Dr. Marcella Nunez-Smith. Again, we've had this conversation ongoing from when Mr. Zients first stepped in to the office, maybe even before he stepped into the office, and Dr. Marcella Nunez-Smith, our neighbor from Connecticut, has been heading the Equity Task Force, and that's a very important position. And again, life is in the doing, and today we are doing. So let me announce and introduce and invite Mr. Jeff Zeitz and Dr. Marcela Nunez-Smith to say a few words.
Good afternoon, Governor, and thank you for letting us join. I want to thank you for having us here today. I'm glad to have the Governor as a partner in this work, and thank him for his since really the beginning of the pandemic. The people of New York State are fortunate to have him fighting for them each day. I also appreciate Majority Leader Schumer and the entire New York delegation for their help in this effort. Leader Schumer's work to pass the American Rescue Plan is critical to giving us the funding to do more of the important work we're discussing here today, including building more sites, just like the ones Governor Cuomo had just announced. We're grateful for the efforts of so many New Yorkers on the ground, the doctors and nurses, the teachers, the teams across our hospitals and schools and grocery stores and public transit. We know that New Yorkers have been fighting this fight for many months. Thank you. We also know that there's still much work. Pleased to be here to share an update with you on our progress and highlight how we're making this work happen on the ground. Soon after taking office, the President announced a comprehensive national strategy to fight the pandemic. This did not exist before. As part of the strategy, the President directed us to activate the full resources of the federal government to get more shots in arms. We immediately got to work. First, we're taking steps to increase the vaccine supply and get it out the door as fast as the manufacturers can make it. Yesterday, we announced another increase in the weekly allocations of vaccine doses to states, tribes, and territories. We've achieved a 28% increase in the first 3 weeks of the administration. We are helping states administer the supply more efficiently and equitably by providing them with visibility into the supply they will receive across the next 3 weeks. That allows the doing that the Governor just mentioned. Second, we're mobilizing